This is the Tujo Show, coming to you from the heart of the Midwest at the Crossroads. We'll be back in a moment to start our fantastic show of the day.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
What is our message today on Two Joes? It is simple. Here's our editorial comment. Politicians don't get it, or at least most of them don't understand common person's day-to-day problems. We elect you to represent us, provide us with our needs to survive. Our needs are simple in nature. We are to be self-governing, and that means we do not want any governmental agency micromanaging our daily lives. The outreach and overreach of the federal government by the progressive Democrats and Republicans have created chaos and confusion. Let's face it, the idiots in the political world want to call health insurance as an inalienable right. They are totally delusional. Healthcare insurance is a choice, not a right, to be demanded or inflicted upon society. Healthcare is separate from health insurance. And what is the discussion today? It is on healthcare part 1. Part 2 will be a PowerPoint presentation with statistics and the things that will support part 1. So let's get right to it. We want to take and lower the cost of our health care. We want to lower the cost of our insurance premiums. Obama destroyed the health care system when he passed his Affordable Health Care Act, and we call it Obamacare in modern day sense. The Republicans have promised for the last several years, in fact, it's been pretty much the last 6 years, they have promised that they're going to repeal it. Just give us the Congress, they say. So they got it. Just give us the Senate, they said, and we'll repeal it. Then after all that, they said, just give us the House, the Senate, and the presidency, and we'll repeal it. Well, we saw what happened a couple of weeks ago. The Freedom Caucus stood up for the rights of the people. And the biggest problem with the plan that was presented by Paul Ryan, and I don't get it. I don't get one bit why they didn't have their act together. Why they didn't have all this stuff laid out and all members of Congress have a look at the bill to start to discuss it like human beings instead of trying to ram it down everybody's throat. And they soft-soaped the President of the United States as it was really going to be a good idea, because we have to do this through the reconciliation part of Congress for the Senate, or we won't get to do it. We can't do it the way just flat repeal it and put a new law in existence. Well, there's some ideas that I have, and I'm going to share that with you tonight as I talk to you about the health care and the health care system itself and the health insurance industry. Think about it for a minute. The law that was trying to be pushed through, there was one major thing that was a big stumbling block right at the start of it. Number one, they promised to do away with all penalties. The penalty phase in Obamacare was they tied it to the IRS to tax you and penalize you if you didn't have insurance. So what did they do? They took all that away. Or did they? No, they renamed it because they said, well, this is how we're going to try to entice people to buy insurance. If you take out an insurance policy for your health coverage and you let it lapse and don't pay the premium, guess what? the insurance company, in order to reinstate you, can charge you an outlandish fee, approximately 30 to 40% higher premiums for a specified period of time as a penalty because you let the policy lapse. That's giving a club in the hand of the insurance companies, and that's not fair. We should never allow insurance companies to get pay in that manner. So that needs to be removed. The other thing, I'm going to explain it to you very simply. When you're young and you are just getting into the workplace, you see, one thing many years ago, because I'm an old guy, I'm 70 years old, many years ago, when I started in the workforce, approximately 53 years ago, when I went out and got my job and started in the workforce, what happened? First thing my dad told me, he says, try to find a company that will give you health benefits. In case something happens, you get sick or hurt, you'll have health insurance benefits that would pay for hospital and hospitalization and maybe emergency room care. Okay, so that's what I did. I set out to find somebody. Now, the company I worked for, as an individual, they paid the premiums. But if I was married, then they paid my premium, but my family part for my wife and our spouse and my children had to be paid out of my salary, which was a discounted fee because we got the multiple discount that the corporation was getting. So you see, that's the way it started. This was 50 plus years ago in the workforce. As things went along, and we decided in the 70s to do the nonsense of HMOs, health maintenance organizations, they started paying for your doctor's visit with a small copay. When I was growing up, you paid the doctor visits as you went. Prescriptions a lot of times were not put into local pharmacy. The doctor would give you enough pills to get you well. But all that changed down through the years. So then, as the mandates changed and many insurance companies went out of business or dropped those plans, they restructured it, and we still had a health maintenance organization to a certain extent because the doctor visits were partially paid for and your prescriptions were paid for, 90% paid for, and your hospitalization was paid for on short-term stays, and catastrophic insurance was also sold over and above what your other normal policy wouldn't cover. Or you could just opt to just have the really catastrophe type insurance in case you did get majorly sick and have to have something major surgery or something done. And saying all that changed. Obamacare, when Obama announced he was changing it, he says you can keep your doctor. No, that wasn't true. We found out later. Oh, you can keep them if you like the plan you're on. You can keep the plan. Wrong. He said those plans weren't adequate, so he chose not to support them anymore and forced the insurance companies to drop them. So then you were down to going to the marketplace to get your insurance, and employers dropped the plans because they were too expensive for them, and all the restructuring, especially the small mom and pop places, which forced you to go get your own coverage. Well, this is the way that went, folks. You went to get your own coverage. Many of you have learned this, through the time, but there's people that were still lucky enough to have employers pay for their medical insurance, or at least subsidize it to where they could afford to pay the smaller premiums. But nevertheless, their deductibles and the premiums themselves went up, which meant the part that they paid for the insurance also went up. So everybody got hurt in this deal. The situation is pure and simple. What they did was basically tried to force the insurance companies to get in a position so they could force one pay type insurance through the government. and change it totally 100% to social medicine. That's why we have to stop it now, because social medicine does not really work. Some people say it does, but mostly it doesn't work. If you're in Canada, a lot of the Canadians say, oh, it's great. Is it so great? Because a lot of you come down when you have to have major heart surgery and other surgeries because you can't get scheduled quick enough and you're liable to die. So you see, there's a lot of issues at hand. Plus there is death panels and death things in the Obamacare that some of us have seen happen to our friends. But what is really going on with this? For example, if you are poor and considered indigent, which means you're impoverished, and you don't make enough money, or maybe you're just lazy and don't want to work, either way, what happens to you is you get to go on Medicaid. And let's stop right here for a minute. Obama took and stole from Medicare approximately $160 billion to support his Medicaid plan for the 20+ million that supposedly didn't have health insurance that wanted it. So what happens here? He stole from that, and we'll talk about what happened to Medicare in a minute. And he put it over here, and so everybody's trying to qualify for the cheapest rate they can pay, and the government will subsidize the rates based on your income. So you can supposedly afford it. This is a way that they can control you and the population, and all of us. Well, what happens at this point, if you're poor and you don't have much money, you pay little to no premiums whatsoever. If you're on total Medicaid, you pay nothing. But you have at your disposal, you have the right for all the preventative maintenance issues paid for 100%. But if you make beyond the magic number that you're not considered in a state of poverty, we'll say, then you have to pay large fees to be able to have the wellness part of the program. And so when you can't have the wellness part, then your deductibles go up. Your deductibles go up because you can't afford to pay for the whole gamut of things, wellness plus insurance. And so your deductibles might go to $2,500. They might be at $4,500. They might be at $8,500. They might be at $10,000. They might even be as much as $12,500 or more. And it's all based on what you want to pay in monthly premium, because that's also going to be high. Your monthly premium could cost you as much, if you want the whole deal, could be as much as $1,200 to $1,500 a month per person. So you can't afford it. And that's where we are today. It's going bankrupt. The intent was to force young people to buy insurance or pay a penalty to the IRS for not, that would be used to help fund the Affordable Care Act, or Obamacare. Now, I know a lot of you listen to Hannity and the other shows, and they tell you bits and pieces of it, but I'm going to just tell you right straight out. You know, I'm an old boy. I'm a common boy. I grew up in the heart of the Midwest, at the crossroads of America. Flyover country. You know, the ones that are right in the center of the country that the politicians call idiots and rednecks because we love our Bibles and we love Jesus Christ and our guns. Well, that's who I am. I'm one of those guys. Listen, you can't have everything and pay nothing. And that's what some of the people think can happen. Now let's talk about the beginning. When you were young and you got a good job and they had health care insurance, maybe you paid a few bucks, maybe you didn't. Even if you did pay a few bucks, it was worth a few bucks, because if you got hurt or in the hospital, you reaped the benefits. But the sad part is, with what is happening in today, we've not educated the young people about insurance. We've not educated them about business to a lot of degree. Some people understand, some people don't. And I don't want to get into the education system because it is broken. You know, we talk about the education and other things from time to time. Here's the long and the short. You want to have a cafe plan. And the cafe plan is you're a single guy. And you don't want to pay for that woman's prenatal care and her health care coverage and all the tests that women are subjected to, which are usually more than men. You ain't going to pay for that. That's what the young people, I'm not going to pay for them big premiums. When I'm not sick, when you're young, you think you're invincible and you're indestructible. And you soon find out that's not the case. But you see, there's a lot of people that don't really get the concept of what insurance is. Insurance is a pooling of money to be used to take and pay out expenses for the people that belong to it. So the years you may not have used it, your premiums went in, you got zero in return. Somebody else got to use that money to pay their medical bills. Next year it might be you that gets sick and someone else is not paying. That's a whole concept of what insurance is about. And because of the gluttony and the quest to make huge profits, we keep building profits and we keep hearing terms on corporate America, ROA, ROE, and so forth. ROA is return on assets, ROE is return on equity. And they're looking to take and have a high return on those so that it means that they have more profitability in the company, which then drives up their per share dividends. Well, I don't want to get into that because I'll get above everybody's head again that don't really understand the inner workings of business. The sad part of this whole deal is the fact if we had free reign to let insurance companies go across state lines and to be nationalized all the way, which a lot of them are, but a lot of them are restricted. If we passed a law that allowed competition and all these insurance companies could go to every state and compete, then your premiums will tend to come down. That's not happening. And it won't happen the way we're set up now. So, back to the policy that the law that Ryan was talking about. He put the penalty in with the insurance companies. The second thing he wanted to do, as you got older, he wants your premiums to go up. Well, let me give you a little clue. That doesn't work. And I'll explain that in a minute. But you don't understand. You don't understand. Those are two major things that he talked about. And the third major thing was providing tax credits for those to help offset the cost of the premiums. Well, now let's see. When I was raising my children, we had a dependent fee that we could take off for each of our children. And we got a little bit more as a head of household for the parent. Well, all of a sudden we got child tax credits coming in. Now, in some cases, there's 41% of the people, let's talk about that don't pay any income tax now. Why? Well, because of their child tax credit and all these other extra credits all of a sudden they get, they don't have any taxable income. It's all ate up. So they get more money back than what they paid into it. Where do you think that money comes from? That comes from the middle class and up in the food chain. So the middle class is a bigger section than the 1% at the very top. So guess who's paying that bill? You and I and everybody else that are above the poverty level. So, no, the tax credits. We don't need any more. We can do some other things. We can give you a tax incentive if you have a health care account to offset your cost. And we can have some leniency on that, where that income is not taxed when you put it in there. And it's not taxed when you use it. So it's tax-free. We can do something like that. But let me explain something about life in general. As you go along down the road and you're that single guy, and all of a sudden you find a nice young lady and you marry her. Now you want to put her on your health care coverage. So when you cafe bought your health care coverage for the beginning of that year and you said, I don't need prenatal care, I don't need this, I don't need that, you might not even be able to put your wife and get her covered for pregnancies and all this such of other things because you said you didn't want that. And when you look at trying to cherry pick what you want to pay for, it's wrong. If you put everything in the plan and you try to get people to buy the plan and you make an incentive for them to buy the plan, and I don't mean give them tax credits and all that Mickey Mouse stuff, the incentive is in volume. The bigger the volume is, the lower the rate can be, because the percentage of odds of everybody trying to use it at the same time is slim to none. So you can have the flat rate. Now when I talk about people getting older, well, I'm part of the baby boom generation. So most of us, the big center section of the baby boom, are now in their 60s and 70s, and they demand more health care because they're older. So you want to raise them when they're on Medicare to the point that they can't afford it, and you want to take benefits away from Medicare so they have to pay more out of their pocket. And you're assuming these guys knew and they put a lot of money back. Well, that's great until Bill Clinton passed NAFTA and a lot of jobs went away and people were 50 years old and got forced to take lesser jobs, or maybe they couldn't even find a job and they had to live off of part of the money they squirreled back for their retirement. Or in my case, I was outsourced when I was 52 years old after working for 32 years for a company, and when I went back to get my retirement a few years later, I found out that I lost 2/3 of my retirement. I wasn't going to get it. So I took what I got, invested it, and 9/11 happened, and guess what? I started losing money. I had to scramble to save what little I had left. And now I'm living on my Social Security check. That's no fun. So the way I want you to look at this, and the graphics will explain a little bit better when I do the PowerPoint in part 2, and it becomes a video, and there'll be some narration with it. It's like you laying a V on its side, and you're down here together, both of you are together, and then as it springs out, as you work and you build your career, you're going up, and then you get to about 50, 55 years old, and you level off, and you go level off for a while, and then all of a sudden you start going down because you're going to retire. So the big swing at the two endpoints of the V laying on its side is where you're going to be. Cost of living's up here and your income's down here. And they shall never rise in proportion. Now the working guy out here has a chance to keep it up as it escalates. You don't, unless you got a lot of investments or you're lucky enough that you can do something and make a few extra dollars here and there. So you see, you can't raise it on the old people, because if you do, they're not going to have it. Maybe that's the intent, because if the old guy can't buy his prescriptions, or old gal can't buy their prescriptions, or they can't go to the doctor, they're going to die off quicker. And I think that's what they're up to. But, in the meantime, that's inhumane, by the way. But sometimes I don't think we have humanitarians in government anymore. And if you look at all the scandals and all the things that are going on, Now, one other thing I want to impress upon you. In the United States, it takes approximately 8 years to get through all the different tests and variation of things on a new drug. And before that, it might take several years to even get to that point. And so when the pharmaceutical companies get to the point and they're in that testing period, and they're in that answering all the questions, trying to get down, find out what all the side effects are, and they release the drug, and they copyright the drug. Well, that's just a short period of time, and then that drug's up to be made in generic form. So they have to get all their money, or most of their R&D money, up front. Because if they don't, they're going to lose. So that drives the cost of the medicines up, which, you know what happens. You as a consumer pay for it. Now, maybe you could lessen the time. The other thing is, you got the ambulance chaser boys. You know, the guys that call themselves attorneys out here. We see it with the car insurance guys every day. Tort claims constantly. Tort claims coming in because somebody run into you and you want this little check, some of them will say, or do you want this great big check that I can get for you? And we allow the attorneys to go on TV and advertise, and it's a fiasco. We allowed the drug companies to go on TV and advertise their new drugs, and oh, this is great, it'll fix this, it'll fix that, take this pill for this, take this pill for that. And so you go to the doctor and say, hey, doc, how about taking that pill? Maybe he doesn't want you to, but you keep demanding it, so he finally puts you on it. So the doc will tell you, if you got a good doctor, he'll say, here's why I don't want to put you on it. You know, these are the side effects, and I don't think you want to do that. But if you keep demanding, they put you on it. So then when you go to the pharmacy and you fill your script, and they give you the script, and they say, any questions for the pharmacy? And they say, now that all the side effects and everything about the drug, please read the pamphlet that's with the prescription here. Some people just throw it in the drawer, they don't read it. So they don't know. So a few days later, a few months later, you took this new drug. And then all of a sudden, here comes this attorney advertisement on. If you took your dope-de-dope-de-do pills, blah, 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 you could be entitled to money coming back. If you had this side effect, if you bled, if you had a heart attack, if you died, maybe your heirs can take and sue the medical form. And everything that they're talking about, all the side effects were actually given to you in that leaflet. Was given to you in the advertisement on TV. Was briefly talked about in the doctor's office. But now, the attorneys can sue and get you money. What do you think that does to the price of health care and medicines? Ooh, goes on up. So, the trial lawyers need to be sidelighted. You need to cap it. And if you're informed that you're going to have possibly one of these side effects that could kill you, and you take it willingly, then why should the rest of the population be paying exorbitant fees for that medication that works for them because your family or you sued them over one of the side effects and got big money out of it? Limit the liability that is on the drug companies when they are sued for something that happens, especially if you died of a side effect that they told you about. Now, it's different if it's something that occurred that they'd never seen before. Then they are probably a little bit more liable. But you see, if we don't fix the trial lawyer thing, work with the insurance company so they can go across state lines and have more competition, then we're going to still be fighting a battle of high insurance premiums and high health care. The other issue is malpractice insurance. It's ridiculous. So look for part 2, because we're going to talk about those things in part 2 when I do the PowerPoint presentation. And remember one thing. It's up to you You should be in control of your life. Not the government, not your next door neighbor, but you. This is Don Wallace. Have a good day. Coming to you from the crossroads of America in the heartland.
Ask not what your country can do for you. Ask what you can do for your country.